Welcome back, podcast listeners, to the Spiro Plastic Surgery podcast series. I'm Dr. Scott Spiro, board-certified plastic surgeon. Today, we're welcoming Gina, one of our just outstanding nurses in our practice, to be our guest. And Gina's we're gonna talk together about some interesting things which we've labeled snatched, snipped, and slightly misleading.
Hello everyone, thanks for having me. Today we're kind of talking about unpacking all plastic surgery terms that we hear online, especially on TikTok, which is our new Google. Talking about mini facelifts, snatched jawline, the mysterious internal bra, mini tummy tuck, everything's mini here. So we're just gonna kind of see, a lot of these are subtle, they often are more involved kind of than the name suggests. So we're going to kind of get into that.
Sounds great. We're going to dispel some myths and talk about the realities.
Yes, right.
So let's get at it.
Let's get at it. So mini facelift. I know you hear this all the time when people come in. So kind of tell us a little bit about that.
I'm dying when we hear when the word mini anything.
Yeah.
So, mini in front of anything usually stands for mini results. That's what I say. And I'm here to maximize outcomes for patients. Oftentimes there is a role and a place for something mini, but if we're starting off talking about facelift, there's no real long-lasting outcome there's just no mini facelift. In fact, when patients come to the office, and you know that, you're in consultation with me with the patient, when somebody says, well, I just want a mini facelift, I say to them, I've been going to facelift meetings for 29 years, and there's never a single topic called mini facelift at any great plastic surgery meeting.
Right.
So what that means is the word mini, usually the connotation is it comes from maybe not even surgeons or surgeons who are dabbling in limited versions. But with limited versions, you get not long-lasting and limited outcomes.
And
so
if you only
I
correct...
cringe with the word mini. That's just me.
Everyone says it. And if you only correct part of the issue, then you're going to need more surgery.
Right. And the most common when they say mini is, I just want this fixed.
And they go like that.
And they go like that. And I say, oh my God, you need a full, proper facelift.
Yeah.
So that's mini. So I won't cringe anymore because that's my cringe-worthy thing.
Yeah. And next, kind of snatched jawline, fox eye trend. A lot of people come in with these photos filtered, essentially, and they say, this is what I want to look like.
Yeah.
So what's that?
Well, people out there can't discern anymore between what I refer to as anime. It's basically a hybrid cartoon human. And they're so over-filtered, they're no longer an actual person. Okay. Right. But I like the term snatched, and that's, new term out there. To me, in jawline, that's what I do. I'll put my neck and jawline up against anybody.
Yeah.
But that takes a full high SMAS composite, bilaminar, deep plane facelift, neck lift, done by an expert, and I love it. Get that really youthful, as they say, snatched look. Now, the fox, what do you call it again?
The fox eye trend.
Fox eye, fox eye trend.
Can't keep up.
I need my nurses to keep me up on trends because I'm just in the operating room.
Right.
And, when people come in and write in advance about these trends that they want to talk about, I have to go to my nurses to find out what that actually is. Okay, fox eye. So I imagine, because you guys are teaching me these trends, fox eye is when somebody wants like a real angulated, pulled eyebrow, right? To me, I don't know, it doesn't look like a fox, but whatever. That's what people say. Okay, you know, within limits, we can deliver things like that. But I like when patients come and tell me what their problems are.
Yeah.
And I ask them what they want corrected rather than come up with these terms. Because there's another term out there like every week that somebody writes. So to achieve that sort of look, what I've done is I have altered my D-plane high-smash facelift to include a pre-hairline lateral brow extension. Often together with my coronal brow lift procedure, I can really manipulate the brow and lateral face to achieve that. Now, to some point, some patients want kind of real over-the-top stuff, and if I don't think that fits with an attractive aesthetic, I'll try to pull them over to our side.
Right.
So.
And always assess, which I always see you do in consults, anatomy first and kind of build a plan from there. Not just from a picture, like you said, you have them come in and you say, what's your issue, what's your problem? Not like this is what I want to look like.
And behind the scenes, what patients and prospective patients should know, I rely on my staff. You know, you guys have excellent eyes, and you're dealing with this every day. You do all our photography.
Yeah.
So you're looking at their face with a discerning eye too. So although the plan mostly comes from me, whether I want it or not, I'm getting your guys' input really on everybody.
Right.
Plus you're also talking to the patient in private when you're in the photography room, so you get a lot of sort of backstory information, which really helps me in plan development.
Yeah.
So
back to mini.
Mini.
'Cause that's our word.
Oh, you're
mini,
killing me.
Mini tummy tuck.
Yeah.
So
okay.
thoughts on that?
All right. Well, here I'm not as harshly opposed to the word mini.
No dagger.
You know, no dagger in the heart of mini. Mini facelift just kills me. But mini tummy tuck, great. You know, there's a lot of different versions of tummy tuck. And I pride myself on, you know, coming up with a plan that suits any individual.
Yeah.
So really mini tummy tuck means, and you know, I teach the Rutgers Plastic Surgery residents and in cosmetic surgery, and I've really helped elevate that residency, plastic surgery, over the last 5-6 years of my involvement. And I kind of break it up in a lecture where we use the word mini tummy tuck to mean skin only below the belly button management. So skin only below the belly button management. So we refer to it, medical terms, as skin only, infra-umbilical, below the belly button, tummy tuck. That's mini. Mini doesn't mean mini incisions.
Right.
So if somebody says, well, I only really I'm bothered just by this, it can require the same incision of a classic tummy tuck.
Right.
So classic or full tummy tuck is abdominal wall repair, abdominal wall sculpting. So if I go back to the word snatched, if somebody wants a snatched look, there's no mini anything, right? They need a full tummy tuck, skin remodeling, abdominal wall contouring. But mini, fine, as long as they have the proper expectation of what a mini can and can't do.
Yeah.
And look, hey, mini, great. Mini may mean mini recovery, but as long as it doesn't really mean mini outcome. If I could deliver the outcome they want with a limited version procedure, no problem.
Right. So face, tummy, now breasts. People ask about it constantly. Internal bra.
Internal bra, internal bra.
Yeah.
So it's interesting because over the last, I'm going to say, half a dozen, maybe 8 years or so, it's kind of changed and means different things.
Yeah.
So it can mean multiple things. So one of the things in our practice that I specialize in is this thing called dermoglandular flap autoaugmentation, where I rearrange the breast tissue, creating an internal bra out of their own breast tissue.
Right.
That can create breasts that look like implants without implants.
Yeah.
It's just a breast lift. It's
Sometimes
unbelievable.
if I don't see them long enough, they come in and I'm like, oh, let me look at the chart again. I'm not
Me
sure
too.
if there's an implant in there or if it's just
I
their
walk
self.
in the room and somebody with a long-term follow-up, and
Yeah.
I'm looking at them, and I'm like, did I put an implant in? Or
Yeah.
I didn't.
Yeah.
So it even fools me.
Yeah.
I know it fools their gynecologist
Yeah.
because the gynecologist will tell the patient, well, you know, you need a certain kind of mammogram because now you have an implant.
Yeah.
And the patient's like, I don't have an
No
implant.
implant.
He did
Yeah.
it without an implant.
Yeah.
So that's one version of internal bra. But
Right.
a classic modern day version of internal bra, not my procedure, is when you use a sort, I will call it a family of tissue additives. So P4HB, they're dissolvable agents that are used to embellish the breast. That's another version of internal bra, and a classic other version of internal bra are acellular dermal matrix, human or allografts, pig tissue most commonly, that can help aid the support of an implant, often with revision. Now, I'm going to tell you my most modern version of internal bra.
Right.
So my most modern version, and that's, so with implant or non-implant, that could either be tissue grafts or meshes. But my newest version of it is in the paradigm shift from under the muscle augmentation to over the muscle augmentation,
Right.
going back to that anime version. Patients are coming in here with pictures of
Yeah.
like non-people.
Yeah.
And what they're showing is that a picture of somebody, like nobody looks like that.
No.
It's like
Yeah.
a cartoon version. But I'm like, okay, if this is the trend, how do I achieve it? So I got to thinking, all right, I did so many years of under the muscle augmentation. Under the muscle augmentation can't possibly achieve these idealized anime breast versions.
Right.
So after a lot of thinking and the development of the paradigm shift, and it's happening with some of the leaders in breast surgery, like myself,
Right.
around the country, we're saying, okay, if we can get those outcomes, but that requires now the implant's got to be over the muscle.
Right.
So back to internal bra.
Right.
So if we put the implant over the muscle, we've got to prevent capsular contracture. Internal bra, use a piece of absorbable scaffold or mesh as an internal bra. Again, it's not a real bra I'm not putting
Yeah.
in there, but I'm creating a bra, basically, and that's been amazing. So I can now get those anime version breast outcomes by doing the internal bra subglandular
Right.
augmentation.
Right.
So
Lots of stuff goes into it.
yeah, for sure.
So let's see. Barbie makeover, BBL, right? It kind of can mean anything, facial sculpting, breast augmentation, liposuction. People forget that BBL kind of is a real surgery, Brazilian butt lift. Fat grafting's powerful, but there's obviously real risks, especially done, improperly. So let's talk about Barbie makeover, BBL. They kind of sound
Let's
cute,
do
but
it,
there's
yep.
more behind the curtain.
Yeah, I love it. I mean, look,
Yeah.
I don't come up with these because I'm a plastic surgeon for 29 years,
Yeah.
and I'm focused on, again, teaching residents. I'm focused on the real terminology, but I love this term, Barbie. Okay, so we've had mommy makeover for decades,
Yeah.
and the connotation of the Barbie makeover is a younger appearing person who, again, is the anime. Barbie is a doll.
Yeah.
It's not a human figure.
Right.
So interesting psychology. So they affix a name, Barbie, to a procedure to try to create an outcome which is snatched in the waist and full-bodied breasts. So, we have a We have a ballerina breast augmentation, which is a small fit breast augmentation that sort of goes with the athletic woman.
Right.
And then the Barbie makeover, which is the youthful, full, lifted, round breast. Okay, so I like the term Barbie, and it's mommy makeover sort of is everybody who has multiple procedures, the connotation being somebody post-pregnancy.
Right.
But nowadays, it does really not post-pregnancy. There's a lot of women, lots of people out there, men and women, and they're going to have to do a Ken makeover. I'm going to coin that phrase, the Ken makeover,
right.
which is for people who've had a lot of weight loss. So they didn't have to have children. So the term mommy makeover isn't really fair anymore.
Yeah.
So I love it, Barbie makeover. And there's also, so that takes care of maybe the younger version. But what about the menopause makeover, right? So the mommy makeover is really all-encompassing, doesn't have to be mommies anymore. So I like the other terms. And it's a combination of breast, face, body. We mentioned, and tummies especially, especially for women who've had a lot of weight loss. And BBL, so not to be taken lightly, Brazilian butt lift. You know, just because somebody's dancing around like a fool in the operating room, a surgeon making light of serious things. These are serious procedures.
Yeah, of course.
I'm a serious person. I joke around in the office, but I'm a serious person when it comes to surgery.
Yeah.
The surgery is the real deal. You got to go to a real surgeon. Yeah. Somebody who takes this stuff seriously, has been doing this a long time. Not some fool who's dancing around an operating room just for some, a like on views, okay? No leader who's presenting at meetings or no professor who's teaching residents is acting foolishly. Surgery is really has to be taken very seriously. Yeah. Now, so BBL especially, adding fat into somebody's buttock. For what purpose? Is it just to make it huge? So for me, I love shape. I want to create everything I do, I want to be beautiful.
Yeah.
And if it's a buttock, I want it to be a beautiful buttock. So I'm not sort of going over the top. I'm not an over the top person. So if somebody wants some ridiculous outcome, I'm not the person. But if they want beauty, then I'm the person.
Yeah.
But it's risky stuff. So I do these surgeries in bona fide either surgery centers with multi-room operating rooms, real anesthesiologists, experienced nurses, or in the hospital. We take in our practice, and I know you do, and my rest of my team, we take this stuff seriously.
Yeah.
And because there are risks, real risks involved. And they're well documented. So BBL, often my favorite in the mommy makeover realm or the Barbie realm, are combination fat grafting and buttock lifts. Actually, to our audience, if you're a plastic surgery historian, go back. I teach my residents. I make them look this up. Go back in the literature. See what the original BBL was. BBL was a term reinvented in the late 90s, early 2000s to mean just fat grafting. But the original BBL, the original out of Brazil, was a buttock lift. That was the original BBL. So to me, the real BBL, the real bona fide BBL, is a combination of fat grafting and buttock lift, if you really think about it.
So when people come kind of asking for a trendy term, what's the best way they could communicate with you?
Well, they have to communicate with you and the other nurses, because if somebody shows up talking about the latest term, look, I'm a surgeon. I don't have time to go on Instagram and TikTok and look at all these trends. I know every surgery and every emerging technology, but unfortunately with social media and all the pressures out there, there are new names and words for things literally every minute. We're filming a podcast right now. there could be somebody inventing a term I never
They'll
heard
say
of.
this is all old terms.
This is a
at
term,
that point.
and I'm
Yeah.
like, okay, that's why. So I studied the chart before we go in the room.
Yeah.
And that's why we like to get information from a patient a day in advance. I want to really go in the room and understand and think it over, come up with a plan before I even see a patient, and then really reaffirm it. So when we get somebody who's asking these terms, they call up. So I've got, a bunch of hip staff, and they know every term
Yeah.
that I don't know. So from the time our front desk staff takes a call,
Yeah.
and they pass it to you guys, I get this flood of information, and oftentimes, you'll come to me and say, well, somebody's coming in tomorrow and they want this procedure, and I'm like, Gina, I never even heard
Yeah.
of this thing. Like, who came up
Yeah.
with this term? So then we'll research it, and I'll interpret what that means in the real language
Right.
of plastic surgery.
Right. We decode it.
You decode
Yeah,
it. That's
we
it.
decode.
I love it. I
Yeah.
love it. You guys decode
Yeah.
it for me. Yeah.
So it's also not only lay people coming up with these terms, posting it on TikTok, Instagram.
No, you're right. And
Yeah.
I should say it's the biggest issue are surgeons coming up with these terms
Yeah.
which have no basis in anatomy, nothing to do with really the surgery, and they just want to be trendy, get a lot of likes, they want big social media followers, they want to be different.
Yeah.
And they come up with these just sometimes goofy or wacky terms that just have nothing to do with the actual procedure, just to be different. I just wish, one of the leaders in plastic surgery at a meeting I recently was at said, we have to get back to using proper anatomic plastic surgery terminology.
Yeah.
And it was met with resounding applause in the meeting. But again, there you go, social media pressures, and somebody
Yeah.
just wants a lot of followers.
Yeah. And we always tailor the plan to what works for the patient, not just kind of what the internet says. So I think that that's the main goal. You always go anatomy and surgeon by trade, artist at heart.
Thank you. Appreciate that.
So I think that that's really big. And I think that your knowledge, which patients and listeners can hear, is more than just a trend online or what they say. And, you got to get back to that.
And we welcome people because, it's interesting psychology when they write these terms.
Yeah.
But again, somebody should be coming in not seeking a trend,
Right.
like copycatting a trend.
Right.
Because maybe that doesn't fit like who they are.
Mm-hmm.
I just want people to understand that. Look, we're very malleable, happy to do what anybody wants within reason.
Yeah.
But it's managing expectations, and I like when I say to them, what are the issues you're having? Like, what is it about either your face or your body that has brought you here to see me? It's not that somebody coined a term. And then what do you want? What do you want to achieve?
Right.
And then I'll come up with the plan. I may not use, kitschy new terms to it, but I'm going to break it down in a very simplified manner for somebody to understand.
Yeah.
And we'll get that achieved.
And we always do.
And if they look like Barbie, amazing.
Yeah, even better.
Yeah.
Well, this has been great. I've honestly learned more. I hope our listeners have. And then now when they come in, they could use this podcast as what they show us. And then we know what they're talking about.
And now you guys know who the brains behind the operations really are here. Thanks again for joining us at Spiro Plastic Surgery. I hope you learned a lot.